Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
Oh, hello. How are you today?
Hello, that's great to hear you. I'm good, thank you. And how are you?
I'm wonderful. I'm with a medical doctor who is from the Ukraine and working in Dubai. And she not only has her MD, but she also has a PhD, which makes me sit up a little taller because she knows my field. She wants to work toward exemplary outcomes for patients. That already makes you a dear friend to me. And it's tomorrow in her world. Is that not crazy? It's midnight in her world for me here today at 3:00. Welcome, Dr. Iryna. Am I saying it right? Iryna. Okay, I'm going to try it again. Iryna Shatokhina.
Iryna Shatokhina. Yes,
Thank you so much for giving me a privilege of not having the perfect pronunciation, but it is a joy and a pleasure to meet you. And am I correct? It's midnight there?
Thank you. Hello from the night from Dubai. Yes, it's midnight here. It's like dark and still hot. So hello from the hot country, and I'm really excited to be here on a guest on your podcast, and hope we will have a productive conversation today.
That is wonderful. Did your work with diabetes get you to Dubai, or was it something else that led you there?
I'm recently joined like Women Children Medcar Hospital, and most of my patients, it's diabetes patient and thyroid gland and different endocrine disease issues. But of course, diabetes, it's the most common patient that I face on a daily basis.
So are you a patient with diabetes yourself? Do you have family that has diabetes? Or how did you choose our community for your life studies and work?
Actually, it's not me choosing. It's diabetes patient always have choice to connect a doctor that they like or they want to be consulted. And so the patient usually make appointment with endocrine, doctors here, and or they can be referred by physician, for instance, as other specialty doctor for consultation. And that's how I get my patients here. So it's like a special sequence. But also if they want to be diagnosed, they can straight book appointment here. So it's not like other countries, they don't have to be referred. If you want to have free appointment, you can get it.
Oh.
But of course, you have to pay for consultation.
Wow, that's good. But what about you yourself? What sparked an interest with diabetes patients?
Yes, my personal interest started nearly 20 years ago when I started my career as endocrinologist specialist. And it was in Ukraine. And frankly speaking, the first year I started working, I started to think how I can help people to maintain this huge work with diabetes. So I was involved in education project, and I was created education school for education our patient in city when I was working at that moment. And it was a really important job because, in my opinion, education, it's everything in treatment diabetes, because without education, we can't move further.
Wow. I think that's great. And of course, doctor means teacher. So without education, we don't even give our services the fullest power, right? Without educating the patients. So that is amazing. Now, with the PhD, you could be an endocrinologist with your medical degree and some training. What prompted you to get a PhD as well? Is there anything in mental health related to diabetes that you have learned and you utilize in your practice?
Actually, yes, my PhD closely related to diabetes, but it was related also to cardiac disease because it's quite important link
Yes.
between diabetes and heart disease. So most of my PhD was involved in, learning course of diabetes in patients with infarction myocardial.
Oh, I see.
Because I found it extremely interesting, and I spent some time for studying and for do all those data and proving that all cases much complicated, much worse course of the disease, cardiac disease, in people who had diabetes.
Mm-hmm. And then how did anxiety show up in those patients?
Usually a patient had diabetes, but it's not only like simple single disease.
Yeah.
Because always connect with mental health, because mental health affects many aspects of daily life, how person think and how handle stress, relate to others. And imagine tomorrow a patient got information that he got diabetes, and how to deal with this disease, how to manage glucose level, how to control everything, how to be strict to that crazy diet that he didn't want to stick to, because our human nature, we never want to stick something that they recommend. Yes, that's true. If I tell you don't eat chocolate now, you will straight want to eat that chocolate. That's how psychology works. So that's really a hard to handle our patient all those things in the same time, because you keep going, your life keep going, and at the same time you got chronic disease, and you have to start living with those disease. And research shows that 20% of people with diabetes, even more, they could have the distress syndrome with overstress regarding their disease during the first year. And even people who get good compensation, they can have distress as well. Mm-hmm. And it's connected with so many aspects that can be affected by having diabetes. Because it's not like only taking tablets. It involves control all your life, including your blood parameters and your diet and exercise, and you have to handle everything. So it's good. I think it's mostly about self-discipline.
Oh, it's so much about that. And I have such compassion for that. I have dealt with type 1 diabetes for almost 50 years. And
really?
Yeah. And so you talk about the mental health side of it. I understand. You talk about the monitor, the Dexcom that I have right now that can tell me my blood sugar every 5 minutes. I remember when I peed on a stick, we didn't have a monitor. And, we've come so far, and every piece of it I know about, but it's still interesting that there's so much yet to learn. And I've talked so much with endocrinologists recently about going from cane sugar to high fructose corn syrup and how that's all happened to us. It is our responsibility. It is our discipline. And it's always going to be our privilege and our obligation. But it also has happened to us as well, right? Just our society. What's your feelings about high fructose corn syrup?
High fructose corn syrup, they mean sorry, could you repeat it, please? Because maybe
high fructose corn syrup is what is in our foods, what is used for sugar now, that makes it sweeter, it's cheaper, and it's everywhere in our foods. If you're not familiar with it, it's okay, but it is almost like a pandemic itself here in our country. And I was just curious what you thought about it.
First of all, I'm impressed you having diabetes. I respect you and all things that you're doing for other people. That's amazing things that you're doing.
Thank you.
I respect it. Secondly, speaking about those fructose, I've never recommend my patient to use any sweetener or any extra carbohydrate sources because it could not be good for the glucose control. So we would rather recommend consuming low glycemic index carbohydrates. It's the key to maintain normal blood glucose and regulate, of course, if you are having type 1 diabetes, to regulate how much units you have to give to cover in each meal. Because actually there is a start conversation between healthcare provider and patient in order to explain how to correct. But it's not like we have to give amount of units you have to do, but it's amount how you can count those carbohydrates. And my personal opinion that it's not good things to use all those glucose, fructose, because they will do not good things in the end. Because the higher glucose you have, and the most likely you will have worsening your diabetes with all those complications that we're always afraid while we're treating our patient.
Well, let me ask you something else. When I love reading that you like listening and answering questions for the patients. And I believe with these non-clinical conversations that because people love social media and they love this kind of a platform, I thought it would be good to speak with doctors and nurses and clinicians, psychotherapists, people who have trained and know their expertise, but where we can talk casually about it without a clinical setting with verbiage that maybe we don't understand ourselves fully sometimes. And we certainly want everybody to feel comfortable talking about what's wrong and how we can fix it and what's right in our lives. And so I was just curious about when someone is diagnosed on your teams, do you find in your country that they have a endocrinologist or access to an endocrinologist? They have access to a diabetes educator and nutrition specialist. And my secret passion is, do they always have access to a mental health specialist?
Yes, I would say that I'm happy to work here because Dubai have really developing a healthcare system, and especially in hospital when I'm working at the moment, we have a very nice nutritionist, and patient could be easily referred to nutritionist, and we have a psychologist support, of course, and we have an educator. But sometimes educator is not here, so our nurses, they highly education in diabetes, and they can guide our patient regarding all those questions that they have. So of course we are using like multidisciplinary approach, because without that results will be not achieved. And in the contrast, I would say in my previous, like in Ukraine, I worked like we didn't have nutritionist, we didn't have access to the mental health provider, and it was me. I was work like nutritionist, like mental health provider, because sometimes patient need attention, and if he can't get that attention from other sources, we are always there for that patient.
That's where I hear that love has grown, because if they didn't have access to what they needed, you became all those sources. Is that why you got the second doctorate? So you would be qualified to help?
Yes, I'm not, actually I have only degree like as endocrinology specialist, but you are a doctor and you understand me very well, because when you become a doctor, you are half doctor but half psychologist, because without understanding patient thoughts, patient problem, you can't manage patient disease, wherever it's diabetes or other disease. We all nearly involved in life our patient. I don't know, especially for me, it's how it works.
Well, here doctors don't get, when I say doctors, the primary care or the endocrinologist just doesn't have the time to specialize in each area for each patient. They're just limited, be it insurance limitations, whatever. There's just a limitation on their time. So most would rather spend more time with the patient. They just don't have the time. So somehow, and I'm unsure how it came to be, but we have the diabetes educator, we have the pump trainer, we have the nutrition specialist, but I don't find the mental health. Oh, it's getting more popular. Years ago, my field wasn't popular at all, but now it's in vogue. But still, it seems that they're referred to me or one of my kind, after they've gone through that first few months of amenability and they've tried it and they fall off the wagon and they're not as amenable anymore. And so they will refer them to us via depression or anxiety. And I just think if we could get the door knocked down, and when they start assembling those teams for the patient newly diagnosed, that the referral would go out right then to a mental health specialist so that we could help them, walk along beside them while they have some amenability to change their lifestyle habits that they've just been shocked that has to change so rapidly. If we have 200 opportunities to eat per day, and all of a sudden we're told, not only are we told that we are now diseased, but now we're told we have to monitor every bite that goes into our mouth. That takes support, and having the support there would be good. So that's all. I just wondered if you guys, with your PhD and your medical degree, I can see how you can do both. It's kind of like comorbidity on the other side. When people have two diseases, heart disease and diabetes, when they have two things to deal with, they have to be double educated. And when you have two services to give, you have to be double educated. So I get it and I love it. But now in the country of your origin, I understand you're saying they didn't have all those things. Is that still true today? They don't have all the services you would like for them to have?
I mean, in one clinic they could not have, but definitely they could go to the private clinic and find some psychologist or mental health provider for help. But it's not like, government guarantee options.
And it's not like in Dubai, not as easily accessed?
Actually, in Dubai, it's easily to access, but some options are not for, free, and you have to pay for that appointment, as in the world, as everywhere.
So since you like to get great outcomes, and you work for that, and that stays a part of your focus, what's something that you tell each patient? Like if you had a patient sit in front of you now that's just been diagnosed, what's a tip that you would give them? Maybe a tip of something they should eat or an exercise they should do. What's something good you would tell them to do for themselves?
First of all, every patient who in my room, first of all, I think it's the most important thing to start with work with his family or her family. So I usually invite wife and husband, or husband and wife and their children, parents, and we work together. Because first of all, a patient who had diabetes have to be supported by their relatives, family members, and sometimes they can even support by eating the same things, the same food, and it could be really supportive, so they can achieve better results. The tips that I can do, very nice to follow and to try to find a doctor, endocrinologist that you can trust and follow, do follow up and, be monitored. And also it's better to join some, diabetes community, to be involved and don't feel like you're alone in this world with diabetes. Lots of patients are the world with diabetes, and you can easily get support from them. So don't feel, alone in this world with your diabetes. And also, I always encourage patients to do, like physical activity, because physical activity can improve glucose level first. It's our target. And second, it improves emotional, mental health. So that could be related to our goal as well. And actually, diabetes, it's always about healthy lifestyle, healthy diet. So in that case, I provide full information regarding dietary advice. And if patient doesn't feel comfortable with all those dietary advices, we definitely refer to the nutritionist, and he had few sessions to achieve better understanding about dietary, special foods that he can eat and he can't.
Well, that
so in general, sorry, keep going. Yes.
It is awesome. I was going to ask my next question, and you answered it already, about how the mental health. So you work in one unit about the mental health and the physical, which is so good. That's not always the case. And so let me recap that. You work with the family. You help them become a unit to work on this together, which is awesome. They should be encouraged to find an endocrinologist whom they trust, which is very important. Not just an endocrinologist, but one that they trust is one that they will hear what they have to say. And then the exercise, of course, helps the emotional balance as well. And the healthy diet, we can't get around it. We can deny it a little while. We can kick and fuss, but we can't get around it. But what I loved is the community not walking alone. That's where I'm going to end this today. I love that you said, join a community, don't walk alone. And that's what this is. We want to be able to connect with you. I want those that I can influence to hear from voices that lead in this space and that knows how to help people in this space. So how can we reach you? Now, I think my team reached you through LinkedIn. If that's the case, could you give us your handle? And then is there somewhere else that if people want to reach you to read what articles you write or talk to you or see you, if somebody lives in Dubai, they can come see you if they make an appointment, right? Where can we find you?
Oh, thank you so much for so much attention to my person. I'm really impressed by it. It's only on my mind to create some nice, blog or podcast or Instagram with education. But I become very busy doctor here, and with all my new life and I just joined the new hospital, and actually I just plan to join to create some education projects here that I'm working in. And maybe in the future, I'll give you some more my details, because now only via LinkedIn or maybe via my email, people who are interested in working with me or consultation with me can join me. And of course, they will get the best support from me. I tell you the truth, some people, I don't know how, somehow they found me via LinkedIn, and they send me blood test and ask for diagnosis. It's not only regarding diabetes, other disease, and I always help.
Oh,
that's so okay. Yes.
Isn't that precious? That is
we are
so
doctors.
good.
We have to help. Yes.
I'm trying to find on your LinkedIn. I'm going to spell the name, if that's okay, because this Southern drawl, I don't say it really well. Iryna Shatokhina. And on LinkedIn, she's a specialist endocrinologist and a PhD. So everybody, I trust that you'll go follow her and as she creates education projects, we're going to keep you in mind and we're going to think about you. And I'm actually going to say a prayer for you. And I'm going to
Thank
follow
you.
because when you make an education project there, I don't see a reason why you can't blog that out and create a program and share it to the world. Let's just help each other. Let's be in a community together. And I hope this is not our last time together. Don't you?
Yeah, I enjoy conversation, and that's really a huge and big job that you are doing by inviting all doctors, to speak about it, because it's really our conversation will create some action, and action will help our patients. That's the main goal. So it makes sense, and yeah, it's perfect to do it. It's incredible, I would say.
It makes sense. Today, I sit here with a hat on my head, and I look prettier other days, maybe. But somebody that wants to hear the voice may, when they come in the office, may experience nervousness, or they feel rushed, or it's not comfortable. So they hear the information, but they don't digest it well. Well, here they can sit in their living room, they can prop their feet up, they can wear their pajamas, and they can listen and watch us as we talk about it, and they can research it, and hopefully it's going to be a place where they can learn. And thank you for all you do in this community. And again, my takeaway, the biggest takeaway that I hope everybody else does take as well. Don't walk this journey alone. Don't walk it alone. We don't have to. Let's walk it together.
Yes, it's an important thing, and especially now when we are all surrounded with uncertainties regarding, COVID situation, and all people affected, and our diabetic patient affected first and affected the worst. So that's how we have to be together to support them, because it's everything about supporting first, and only second about treatment.
Yes.
This has to sound like that.
Well, whether you're diabetic, whether you are the helper, the one that serves the patient, our hearts, not even our physical hearts, but our hearts are for each other. And when we can build relationships, our physical heart is better. So thank you for what you do. Do you ever get to the...
No, unfortunately, no, I've never been to US. I think one day I will be visiting your beautiful country, and yeah, that would be great.
Well, I have counseled a little bit in Dubai, but not ever getting to be there. But I understand it's beautiful. I've never been to the Ukraine. But do you hear any country music in Dubai? Have you ever heard country music?
Yeah, they have like local music, and it's like local music. And yes, I can hear like when I, in taxi or somewhere. But there are also multinational city, and you can meet people from other country, other descent, lots of Indian, different people. So it's not only about local, and they all prefer their own music. So you can see and
you can find it all.
Different. Yes,
you can find it
like.
all. Well, why I was saying that, I live in Nashville, Tennessee, and
yes.
It's country music heaven. So
I love country music.
So if you ever get here, maybe we can sit down over a cup of coffee, listen to a good old country concert somewhere, and enjoy life together for a minute. And that will help our health be stronger.
Yeah, that's amazing. Yes. Thank you.
Thank you so much for joining me. Don't let this be the last time. If you have need of me, you have my contact information, and I have yours, girl. We're going to stay in touch.
Yes, thank you very much for inviting me. I really enjoy conversation with you, and I hope that you are doing the really nice and right things, and you will support most of, lots of patients and their families, and, we can work together. That's important.
Thank you so much. And those English-speaking patients you have, please refer them on and let them hear in the community. And as you get your podcast going, I will do the same. And that's how we get the word out. I have a program coming out soon about reversing anxiety. So it may be something some of them want. And then as you get your education project on, that's how we're going to reach people in this new world, is right on this PC, on this powerful internet. So thank you again, and we'll be in touch.
Yes, thank you very much, and have a nice day.
Bye-bye.
And stay safe and healthy.
You too. Bye-bye.
Yeah, bye.